Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, so without wasting any time, let's get started. Coming to the must read questions, see, in simple words, these are those questions. If you skip these questions, don't go for exams because most of the questions will be coming from this. So you have to read each and every question in this section. So under 10 mark questions, those are radial nerve, shoulder joint, mammary gland, and median nerve. Now either they will ask this directly or they will give a case scenario where these nerves are injured or there is shoulder joint dislocation or there is breast carcinoma, and they will ask you to explain. And coming to the 5 mark questions, deltoid muscles. See, deltoid muscles, they can of course they can ask origin, insertion, nerve supply and actions, but also they will also they can ask the structures under cover in the deltoid muscle. So you have to study all those. Deltoid muscle is a very key question, and all those case based questions, because nerve injury, shoulder joint dislocation, breast carcinoma, usually one case will be there from the upper limb question. And apart from that, axillary nerve, flexor retinaculum, cubital fossa, rotator cuff, brachial artery, intramuscular spaces around scapula, serratus anterior. Now serratus anterior, they will either give winging of scapula case and they will ask, or they will ask directly. And iris paralysis, same thing, case based, because see, this chapter is a favorite examiner's chapter for giving case based questions. There are plenty of case scenarios that can be formed, and all these topics are very important. One more is clavipectoral fascia, so don't skip even a one question under this section. Now coming to the good to read questions. Now if I tell you, if you consider the whole upper limb chapter as 100%, around 55 to 60% questions will be coming from the must read. Okay, 35% questions can be coming from the good to read, and 5 to 0 to 5% will come from may read. So your first goal should be reading the must read questions from all the chapters. Of course, we are going to upload each chapter, so do that. First complete all the must read questions, then go for good to read questions. If you have completed both and if you revised both of them once, then read the may read questions. Okay, so the may read questions are those who need distinction. Okay, one question maybe come from that section in the whole paper, so if you want those extra marks, read that. And must read is enough for pass. Probably I can say that because these are that important. Then good to read, yeah, it's for getting the distinction or going to the close for that. Okay, so good to read questions, of course I mentioned ulnar nerve, brachial plexus, and pronation and supination, events occurring at level of insertion of coracobrachialis. This events occurring at level of insertion of coracobrachialis, it is there in Vishram Singh, but I think it's not there in BDC. So don't worry, we will upload all the videos one by one as the time permits. So before the university exams, you will be ready with all the questions. So hit that subscribe button if you are not subscribed yet, so that you can get all those videos. Okay, next, yeah, case rotator cuff tendinitis and axilla, boundaries and contents, triceps, clavicle, musculocutaneous nerve, movement of scapula and winging of scapula, pectoralis major, median cubital vein, palmar aponeurosis, lumbricals, interossei of hand, ulnar nerve in hand, extensor retinaculum, and first carpometacarpal joint. Now see, one more thing I observed in previous few papers, that they are tend to ask any muscle from this, because there are so many muscles. Usually they have been alternating, like one year they asked triceps, then they asked serratus anterior, because last year we got serratus anterior, winging of scapula. Before that they asked deltoid, and then before that they asked this one, pectoralis major they had asked once. So give some more important for muscles and one case based questions. That is a like of blueprint of this chapter. And then may read questions, axillary artery, pectoralis minor, axillary artery. So these questions, like, very rarely they will ask. All those things you can read. Okay, so I have mentioned it here. Again, pectoralis minor, axillary artery, rhomboides major muscle, trapezius muscle, cephalic vein, biceps brachii, anastomosis around elbow joint, radial artery, superficial palmar arch, anatomical snuff box, elbow joint, radioulnar joint, and movements of wrist joint. 3 mark question I have not mentioned in this video because there is a confusion regarding it, whether you will have the give reasoning question or the theoretical 3 mark question. So what we will do is, once we upload all these questions, then probably we'll make 2 videos. In one video, we'll cover all the 3 mark question that can be asked in this. Because one more thing is that 3 mark, they can ask anything. But there are some few favorite questions that we will cover in that video. And apart from that, yeah, it basically tests your anatomy knowledge. And in one more video, we will cover all the reasoning questions. So that's how we will go. So that's all for this video. If it was helpful, do like and comment, and yeah, comment which video you want next. So that's all for today. Thank you very much. Keep studying. Do well.